And we're live. Hey, everybody. Welcome back to another, what I'm sure will be a fantastic episode of This Week in Global Health. Today, we're going to give you a global health news roundup of things that caught our eye, from environmental health to universal health insurance in Nigeria and to a new tool for HIV prevention in women. I'm Jessica Taaffe, and I'm hosting this show today from the Washington, D.C. metro area. And I have a fantastic group of ladies with me today who will tell you their news stories of choice. So, ladies, why don't you go ahead, tell us what you're going to talk about, introduce yourselves, and also where are you reporting from today?
Hi, I'm Vijoleta Gordeljevic. I'll be telling you a bit about a new WHO assessment on the environment and health, and I'm reporting from Quito, Ecuador.
And I'm Marie Onakomaiya, reporting from Washington, D.C. today, and I will be talking about this universal health insurance program in Nigeria.
And hi, I'm Sarah Borg. I'm talking to you from Geneva in Switzerland. Today I will be discussing the new vaginal ring, which releases antivirals, which has helped to reduce HIV infection rates amongst African women.
Excellent. Well, let's get started. Vio, why don't you go ahead and tell us what caught your eye this week?
Sure. So the WHO has published a global assessment on the burden of disease from environmental risks. And it concludes basically that 23% of global deaths are due to modifiable environmental factors. So what does that actually mean? It basically means that 1 in 4 people on this planet die because of the environment they're surrounded by. This environment can harm them through air, it can harm them through water, to soil pollution, it can harm them through exposure to chemicals, but also radiation, and in the broader sense, climate change. So this then results in a bunch of non-communicable diseases, according to the report, such as respiratory diseases, strokes, but also injuries and a bunch of cancers. And it goes without saying that the assessment also found that low and middle income countries bear the greatest share of the burden of these deaths.
Vio, that's interesting to learn that about these rates of disease. But given that it's environmental, how much control do we have over these deaths?
Well, what makes this so shocking, and what actually should make it shocking, I believe, is that those 23% are in fact preventable deaths, or we could at least reduce the number to a great extent. They're not naturally caused, they're not beyond our control, but in fact, it's pretty much the opposite. We created them through the environments that we created, right? So, and this is why governments and policymakers could actually help prevent them by implementing stricter regulations on those environmental risk factors, but also by including, putting stricter regulations on certain corporations in low and middle income countries. So there's a bunch of things that we could actually do to decrease this number greatly.
Got it. All right, Marie, I believe you're going to take us to Nigeria and tell us something that's going on there, right?
Yes. So a recent report from Nigeria, where the federal government is planning to implement a universal health coverage program. And this started because for a few years now, the Nigerian Ministry of Health has identified the increasing rate of what they called outbound medical tourism as a concern for the healthcare sector. And recently, in the last few weeks, announced a 3-part plan to counter it. It's called the Nigerian Health Insurance Scheme, and it's a piece of the National Health Act, which is one of the pieces of that 3-part plan. Now, initially, the health insurance program will not be mandatory, but so far, all federal employees have already been enrolled, and the program has a target of enrolling 40 million Nigerians by the end of the year, which is about a quarter of the population. Why I thought this was interesting is that it has met with a lot of criticism, this announcement, from national experts who believe that the federal government should actually be focusing on improving medical education, infrastructure, access to quality and affordable healthcare, rather than targeting medical tourism. And this is particularly interesting because recent reports have shown that medical tourism costs the Nigerian economy somewhere around $1 billion each year, which is much lower than what previous reports had stated. So it kind of flies in the face of their argument that this is such a huge burden on the economy. And so it goes back to the original reason that they said they wanted to target medical tourism, was that they wanted to restrict the use of federal government sponsorship by public officials for medical tourism.
Interesting. Yeah, I mean, medical tourism is just this fascinating thing to me, and I've here in the U.S. I've heard about it, and I've, every now and then you're like, oh, I guess you could. Let me just put this out there. I've not considered doing this, but like they like, oh, you could get like a tummy tuck in Brazil or this and that, and I hear people doing that, but I know it's even more common in other countries, like you're saying in Nigeria and stuff. So it's interesting, and now that the government is actually trying to address it, which will be fascinating to see how that goes forward. But I want to ask, are there any specific medical conditions that are more associated with this medical tourism?
Yeah, actually, in general, more complex cases tend to result in medical tourism. There are 4 areas in particular that account for about 60% of medical tourism from Nigeria, and that's oncology, so a lot of cancer, cardiology, nephrology, especially renal dialysis, and then orthopedic issues. And it's important because maybe this is where the country should focus on improving the expertise that's available in country, because not only will this mitigate medical tourism, as seems to be the focus, but might also provide care for those who don't have the option. And I wanted to speak to the point you made about people from the US going abroad for care. A lot of times medical tourism has always been seen as something that you do from a high income country to somewhere, maybe middle income, where they have expertise, but healthcare is not as expensive. From a lot of places, especially in developing countries, a lot of those in the elite classes are doing what in some sense is the opposite. They're leaving a relatively resource poor area to go and get care in highly developed countries, or somewhere in the middle, like going to India and things where they have really good healthcare, but it's affordable.
Yeah, I think that's really interesting, Marie, that you talk about how, there's a one way of looking at, like I just described, of, oh, it's cheaper to go get this done in another country. And it's almost like an exploitation from the higher income countries to be doing this. But at the same time, there's this other side of where there's better healthcare in other countries. So, from like someone from a low income country and then going to a higher or middle income country where there's better healthcare. And well, I mean, we could go on and talk about this in so many ways. So I won't go on about, maybe we should do an episode on it, but I think Sarah had something to say about this.
Yeah. So what are the countries that people are kind of, coming from or going to?
Gotcha. Yeah, so India is probably the most significant destination. Something like 47% of people who go to India from Nigeria go there for a medical reason. But that report that talked about the $1 billion being about the amount it costs estimated that it's only about 30,000 people who leave the country for medical tourism. So it's interesting because the government has really highlighted this. They've had a lot of symposia and conferences talking about the problem of medical tourism from Nigeria. Yet the numbers don't really support that. What is interesting is, Nigeria always talks about wanting to be this giant of Africa. But unlike South Africa, where they actually have a decent healthcare system, Nigeria does not. There are certain hubs in Lagos and Abuja where you can get pretty good healthcare. But if you want something like a kidney transplant, you would better have a higher chance of survival if you went to India or somewhere like that. And so people who have the means tend to do that.
Thanks, Marie. That's obviously we're all kind of interested in this topic. Maybe we should do an episode on medical tourism in the future. So, but let's move on. Sarah, I believe you were going to tell us about something that happened in HIV recently.
Yeah, so following on with the thread of Africa, I'm talking about, so in some recent news, an inexpensive vaginal ring inserted into the vagina once a month has been shown that it could provide protection against HIV infection. So there was a recent phase 3 randomized control trial in Malawi, South Africa, Uganda, and Zimbabwe. And it found that the monthly vaginal ring, which contains antiretroviral medication, reduced the risk of HIV infection among African women aged 18 to 45 years. A similar trial was conducted in parallel and found similar results. This is important because regulators usually require data from 2 studies to approve a new product. So the ring, however, did not completely prevent HIV. Overall infection rates were reduced by 27% and 31% in the 2 studies.
Sarah, let me cut in here and say, I'm really happy that you're bringing up the study again. It was something that actually Sultan and I discussed on our segment with Global Health Out Loud last month. But I think it's totally worth bringing up again to people that didn't see that video. If not, we can give a link to that. But I think this is a fantastic study and the beginning of something really important in the HIV prevention field. Now, you mentioned a really important point. The ring isn't completely protective, but I still think even in this context, it's important to point out that these results are really significant to the HIV prevention field because, one, the ring can be used as part of HIV combination prevention, which basically means that a number of behavioral and biomedical interventions are promoted and used together for HIV prevention. Also, it addresses a really key issue that makes women vulnerable to HIV infection in some parts of the world. Basically, gender inequality and their ability to negotiate condom use with a sexual partner.
Exactly. So, I mean, a key success factor is that women can use this device independently. So, yeah, while a man might refuse to wear a condom to prevent STIs, including HIV, a woman can insert the ring herself and neither her or her partner can feel it. And she doesn't even have to tell the man that she's using it. Another thing worth noting is that the device was considerably more effective in women over 25. So more research is needed to find out whether there's some biological factor making young women more susceptible to HIV infection and harder to protect. This is really important as adolescent girls and young women in sub-Saharan Africa are really disproportionately affected by HIV.
I was wondering, why isn't it more effective?
Yeah, sure. So, well, one issue is that the ring has to be used all the time or it doesn't work. So in these studies, they found that approximately 25% of the women use the ring highly consistently, which is actually a very similar rate found in other studies in sub-Saharan Africa involving pills and gels offered for HIV prevention. So that's seen as the main issue at the moment.
So, Sarah, you actually bring up something that I hadn't come across, but it makes sense. Men and women can't feel it, and maybe this is getting into too many details about sexual intercourse, but I think that's an interesting thing that men can't feel it. Do you know any more about this? It's one of those things I'm just kind of curious about how that goes unnoticed.
I mean, I guess I imagine, and this is not something I've read about, but there's a vaginal ring that can be used as a contraceptive, and that's also not meant to be felt by the woman or the man. So I guess it's quite similar to that. And they're both structurally very similar. They're thin, flexible plastic rings. So they're meant to be quite discreet. And I mean, yeah, there's a huge issue, like you said, with inequality and women not being empowered to, ask for condom use. Sometimes their partners might not be okay with them taking the contraceptive pill for various reasons. So that's why it's so great that there are contraceptive and HIV prevention options that the men don't need to know about and women don't need permission to use them.
Absolutely. I couldn't agree more with you on that one, for sure. Well, I think that is all we have for today, but I want to thank my panel for presenting our stories of interest, and thank you to the audience for tuning in to our show this week. And if you want to catch more, you can find more of our episodes on our YouTube channel, This Week in Global Health. Also, you can visit our webpage where we have a blog, we have links to our Instagram, you can find us all over the place. Our webpage is TWiGH.org. So find more there and continue watching, tuning into our YouTube page or our website to find out more information, and keep tuning into our shows. It's been great. Talk to you guys later. See ya.